Mnemonics. So today's video I'll be mainly discussing upon the classification of general anesthesia, and in this video we'll be particularly mainly focusing upon the mnemonics as to how we can very easily remember the entire classification of general anesthesia, and particularly the mnemonics we'll be discussing that as to how we can very easily remember and pen down and sequence the mnemonics in exams about the classification of local classification of general anesthesia. So students, beginning with, so the entire general anesthesia, when we look at the classification, it can be broadly subdivided into two broad categories, that is the inhalational general anesthesia, where the general anesthesia is given through the inhalational route, and the other is the intravenous general anesthesia, where the anesthesia is administered through the intravenous route, that is through the blood vessel. So the classification, when it comes to writing in the professional exams, you can very easily pen down and sequence just by remembering the easy mnemonics what I have made for you. So starting with, firstly, the inhalational anesthesia. Since the inhalational anesthesia is being given through the inhalational route, so what is happening is that these are actually the compounds, the chemical compounds what are used is, they are basically the volatile liquids are there which can very easily vaporize, and they can gain access through the nasal cavity, the nasal chamber, and there can be inhalational route gases can be given. So either these inhalational general anesthesia, they are of two types. Firstly, they can be either volatile liquids, and the next they can be gases. So these volatile liquids, when we try to remember, it becomes very cumbersome to pen down and sequence the drugs, the chemicals what fall under the volatile liquids category. So if we just remember the mnemonic, that is He, side, He and SIDE, side, we can very easily remember and sequence the drugs what are falling under the volatile liquids of inhalational general anesthesia. So the H of the He is referring to the halothane, the E is referring to the ether. So He, that is capital HE we have covered, and SIDE is the side. So this S of the side is referring to the sevoflurane, the I is referring to the isoflurane, the D is referring to the desflurane, and the E is referring to the N-fluorine. So just by remembering the word, that is He, side, H halothane, E ether, S sevoflurane, I isoflurane, D desflurane, and E N-fluorine, we can very easily pen down and sequence the volatile liquids which fall under the inhalational general anesthesia in the classification. Now when we look at the gases, so the gases what are basically used for inhalational general anesthesia, there is only one single gas what is called as the nitrous oxide, which is also called as the laughing gas. Now next we have the intravenous general anesthesia. So these intravenous general anesthesia can be broadly subdivided into, that is the inducing agents what are used for the induction, and the next is the slow acting drugs. So just by in this under this category of intravenous general anesthesia, we can very easily remember the inducing agents in the form of PETs. So just remember the word PETS. So the PETs, if we just remember the mnemonic PETs, the inducing agents can be very easily remembered. That is, the P of the PETs is referring to the propofol, the E is referring to the etomidate, the TS of the PETs is referring to the thiopentone sodium. Now the next category, that is the slow acting drugs. So the slow acting drugs can be broadly subdivided into 3-4 categories, and we just need to remember the word which is called as the bond, that is BOND. So the word BOND, every alphabet is going to refer to one classes of the drugs. So the B of the bond is referring to the benzodiazepine drugs, the O is referring to the opioids, that is fentanyl, the N stands for the neuroleptic analgesia. So the neuroleptic analgesia, so the example for this is droperidol, and the D is referring to the dissociative anesthesia. So under this category, we have the ketamine. So just by remembering the word BOND, that is the benzodiazepine, the opioids, the neuroleptic analgesia, and D stands for the dissociative anesthesia, under which comes the ketamine. So just by remembering the word bond, the word pets, and the word he side, we can very easily pen down in sequence the drugs which fall under the classification of general anesthesia. Students and viewers, if you like this video, give this video a thumbs up, and if you are new to my channel, you haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If there are any queries or comments, you're most welcome to comment me in the comment section. So if you like this video, give this video a thumbs up, and don't forget to share amongst your friends. Thank you for watching.